Mayor de Blasio is giving an update on the coronavirus pandemic in New York City. Let's listen in.
New Yorkers do not lack for confidence. We are a people who believe in ourselves. We believe in our city. We have a certain energy and a certain spirit that is renowned all over this world. And we need that now more than ever. That essence of who we are is what's going to see us through this fight. I'll tell you something, even a pandemic, even the worst healthcare crisis in a century, even an economic crisis that only rivals the Great Depression, even with these things happening at the same time, I have not seen New Yorkers lose their confidence. I've talked to a lot of people, all walks of life. I'm not going to say there are no doubting Thomases, but overwhelmingly, New Yorkers tell me they are confident that we're going to come through this and come through this strong. They are confident about the role they are going to play in fighting back this virus and bringing this city back to life. Now, this virus, understandably, this whole crisis we've gone through, it's not surprising if it gnaws at that confidence, if it sows doubt. That's normal, that's human. Who wouldn't feel some moments of doubt in the middle of something this difficult? And that uncertainty that comes with it, a disease that still is not fully understood by the global medical community, a disease that we all wonder about in terms of our own personal lives. Even though we're confident by nature as New Yorkers, there's uncertainty pervading this whole experience. And the most essential question we all ask is, have I gotten this disease already, or am I going to get this disease? If I have gotten it, or if I do get it, do I put my family in danger, the people I love in danger? The uncertainty is directly related to the lack of testing that's been the reality from day one. And this has been the central problem in this crisis, the lesson we have to take from this as not only New Yorkers, but as Americans. Our nation wasn't in position in terms of testing, and we can never let that happen again. But what we can say for sure is that every day more and more New Yorkers are getting tested. Every day there's a little more confidence because there's more answers person by person, and they're starting to add up thousands, then tens of thousands, then hundreds of thousands. And it's going to give us a clearer picture of what's going on. It's going to help people have more certainty in your own lives. And it won't happen overnight, but it will happen steadily from this point on, and we'll be moving in the right direction. So to feel our natural confidence as New Yorkers and to answer those uncertainties, the key is more and more testing. And that's what we intend to do. Now, there's two kinds of tests. The diagnostic test, known as the PCR test. That's been the main part of the discussion from the very beginning of this crisis, and we still need to do a lot of that. And then there's the antibody testing. Remember, there's a clear difference. The PCR test, the diagnostic test, answers a simple question: do I have this disease right now? It does not answer what happened in your past. It does not answer what happens in your future, but it does answer clearly and consistently, do you have the disease right now? It allows us to take the actions right now we need to take in a test and trace approach. The antibody test really refers to the past. It asks the question, did I get exposed to this disease in the past? And it therefore helps you understand the obvious answer of your own experience. If you did get exposed in the past, were you able to beat it? Well, you know, it's a good sign when you know your body's been exposed to this virus and you obviously came through it. It's a good sign. Does it tell you everything? No, and we'll always put that disclaimer on it. There are different kinds of antibody tests, some more accurate than others, some more specific than others, and even the best antibody test does not guarantee that you can't get the disease again. Seems that it's unusual for someone to get the disease again. That's what we've seen so far in our actual experience, but it is not a guarantee. What it does tell you is something, and right now we could use all the certainty we could get. We could use all the information we could get. Any step in the direction of more information is better. And if someone knows they've been exposed before, that's helpful. That gives people more confidence to know they came through it. It's also really valuable in terms of the emerging treatment using plasma from folks who have been exposed before. That's a positive development that we want to support more and more testing for antibodies does that, helps that along. And it's also part of answering the bigger questions about this disease. The more people we test, the more our doctors and scientists have a body of information to help us really understand the disease better and beat it back. So we are going to proceed energetically with antibody testing in this city, as we also build up the PCR testing capacity at the same exact time. Now, I've talked to you before about the effort focused on our first responders and our healthcare workers. That is a joint effort with the federal government, with the U.S. Department of Health and Human Services and the Centers for Disease Control. It will reach 140,000 healthcare workers and first responders, everyone making their own choice if they want to participate. They will get individual results, but it'll also help us with the larger research we need to do. 140,000 New Yorkers will be tested. It will start next week at hospitals, firehouses, police precincts, correctional facilities, and we're going to move that rapidly over the next few weeks ahead. But now, a new announcement today. Beyond the testing that we'll do for our heroes, we're going to open up antibody testing to a much bigger group of New Yorkers, so more and more people have the opportunity to get a test that will give them some information, some certainty as we fight ahead. So, as we do this, I want you to remember, every time someone gets an antibody test, it's helping them have information, it's helping all of us to have information. So we're really killing two birds with one stone. The individual gets something they need, but the healthcare leadership, the scientists, they get the information they need to do the research better to answer the questions about the disease. So real virtue in this. On top of the 140,000 for the first responders and the healthcare workers, we're adding another 140,000 for everyday New Yorkers. Combined, 280,000 people will get antibody tests in just the next few weeks in New York City. Over 250,000 antibody tests will be given. These are numbers that really start to add up, even against the size of a city as big as ours. This initiative, the additional 140,000 that will be available in communities across the city, comes through a partnership with BioReference Labs. They've been an extraordinary partner with our public hospitals, health and hospitals. They've been a key part of our response to the coronavirus from the beginning. I want to thank the CEO of BioReference Labs, Dr. John Cohen, who's worked very closely with the city throughout. The first survey will involve 70,000 New Yorkers. It will start next week and continue through the month. It will be repeated again in early June. So we'll get these 140,000 additional tests done between the remainder of May and the beginning of June. We're going to work with 5 sites initially, but then we will be adding. And the goal is to focus on people in the general area of these test sites. I want to be very clear. There's so many people in the city. Any time you set up a test site, tens of thousands of people live very nearby. We want to focus on where the test sites are, not having to have people travel a long way to get to these tests, but we'll keep adding sites as we go along. So the sites will be in the Bronx, in Morrisania, in Brooklyn and East New York, in Manhattan and Upper Manhattan, Staten Island, in Concord, and Queens and Long Island City. 1,000 tests per site every day. Again, 70,000 tests will be given in the space of about 2 weeks, and then we'll repeat that again. Now, how does someone get this test? You get it by appointment. Again, the priority given to the surrounding communities. And the hotline for making the appointments will be launched this Friday, tomorrow. Now, how does it work? You give basic information, because remember, this is to benefit you as an individual, but also to get us information on what has been happening with this disease so we can fight it. So people will be asked demographic information, employment information, very important. We want to understand how the disease has hit people in different parts of our economy, in different parts of the life of this city. It's a simple procedure. A nurse takes a blood sample. You get your individual result back in 24 to 48 hours. So even though this is the kind of thing, this testing and the PCR testing is what would have made so much of a difference early on and could have fundamentally changed the history of this disease in this city if we had had it early, still helps us now to learn more and more, and obviously to give more and more New Yorkers the confidence in knowing their own situation. So we will keep you posted as more and more details come out, but I'm looking forward to, between the two kinds of testing, becoming more of a norm in the city every day, that people are getting to those tests, and we're getting a better and better picture. And it's all going to contribute to our efforts on testing and tracing, which are going to be developing rapidly in this month. Okay, next thing I want to talk about is how we continue to deepen our response to this disease using every tool at our disposal. We already know some things. We want all the research we can get, but we know some things already, and we've been very open about the very sad fact, the very troubling fact, that this disease tracks with profound healthcare disparities that we already knew in our city, and it's only made them worse. So when we came out with the information on the disparities, when we showed the just painful, raw truth about what's happening with healthcare disparities and the impact of the coronavirus, we talked about a 4-point equity plan to address the needs of communities that have been hardest hit. The 4th point in that plan regarded telemedicine. And we are now going much farther with telemedicine than we have ever gone before, through our public hospitals, through health and hospitals. And the focus, again, will be on the communities that have been hardest hit by this disease. So telemedicine had become increasingly common in private healthcare, but not as much in public healthcare before this crisis. Now, health and hospitals will be doing it on a massive scale. So first, phone a clinician. This initiative, very straightforward. And it's one of 2 key things that we are now putting into play. Phone a clinician is about what you do individually. It means that you know, as a New Yorker, if you don't happen to have your own doctor, if you don't have a place to turn to get an answer to a question, that you can pick up the phone for free and get a healthcare provider from our public hospitals and clinics to answer your questions. We want people to get much more guidance, even though more and more information is out there about the coronavirus. And again, New Yorkers have listened, because you can see in how much progress we made in the city. That's because of your work. That's because you listened and learned and acted on what you heard. There's still so many questions. Every hour, every day, people have questions. The best thing is to know there's some place to turn where you can talk to a medical professional and get answers, particularly in communities that have been hardest hit. Helping people get the truth about this disease. Helping people navigate tough situations, the most obvious being, if you have symptoms, what do you do? Or if you have symptoms, how do you deal with keeping the right distance from other family members? Or if you test positive, what are your choices for how to isolate and quarantine? It's really helpful for everyday New Yorkers to have someone to turn to at any hour of the day that they can trust to give them real answers, not just a piece of paper or something they see online, but an actual human being. So the free hotline is 844-NYC, the number 4, NYC. Again, 844-NYC 4-NYC. And this means that anybody, anytime you need to, can pick up that phone and get answers and never leave their home, never have to go through the hassle or the challenges that come with going outside. We keep telling everyone stay inside to the maximum extent possible. Therefore, telemedicine is part of how we give people confidence they can get the help they need without ever leaving their home. Now, this initiative is growing all the time. So far, in the midst of this crisis, we've had about 90,000 calls, and the result is that over 90% of the people who make that call never need to leave their home, get the information they need, get the care they need through the telemedicine process, and it works. We want to keep building on this. Now, our goal, all of us, is to drive back this disease and not need as much help. But we know we've still got a road ahead here. So our goal is to keep building up this apparatus. We expect to do at least 4,000 calls a day, and if the demand is there, we'll keep building more. So in the month of May, we're ready to handle 120,000 calls. And again, if this becomes a popular tool, if more and more people make the decision to pick up the phone and that's helpful to them, especially, again, those who do not have a private doctor or a facility that they're already working with that they can rely on, the more people use it, the more we will build it. But expect about 120,000 calls in May. That's going to make a great impact on the lives of those people and their whole families that they have access to that help. Now, the second piece of this strategy is televisits. And this is a different approach because this gets initiated by the healthcare institution. So think about all those H&H hospitals and community clinics. A lot of them, of course, have a deep constituency in their neighborhoods of people who have been coming to them, are connected to them. In this instance, this means that the provider reaches out to the patient to check in. Obviously, the vast majority of people are not going to normal appointments right now. Now, previously in our health and hospitals facilities, particularly the community-based clinics, televisits were pretty rare, almost none. The whole idea was show up in person. Now, already during this crisis, there's been 60,000 televisits initiated by health and hospitals clinics. This is going to deepen. This is going to be a big part of the strategy going forward. So the goal is to ramp this up to at least 16,000 per week starting in June. We believe that at least 80% of people who need help through our clinics for now can do it through televisits. So it'll be aggressive, a program by the clinics to reach their patients, check in with them, make sure they get whatever appointments they need. Of course, if someone needs to be seen in person, they still can be. But the goal is to the maximum extent possible, lean on televisits, reach a lot more people a lot more quickly, and always give people the option of getting health care without having to leave their home. Now, look, for our public health care system, this is opening up a whole world of possibilities because this is now helping us understand things that weren't used so much before but might be really helpful, not just during crisis, but as we go back to normal, might allow us to reach a lot more people. So this is an example, something we're going to refine more and more while we're fighting back this disease. But I think it's going to be a crucial part of our restart and recovery and making a city that works better and is fairer. If we can perfect the use of telemedicine in public health care, we're going to reach a lot more people, and we're going to reach them faster. That could be an example of something that comes out of this horrible crisis that actually makes us a better city in the future. Now, this crisis has been tough on everyone. But we know not only have some communities been particularly hard hit, we know some New Yorkers are going through a particularly tough time as individuals. And in this case, I'm referring to homeless New Yorkers, people who live on the streets. Those 3,000 or 4,000 people at any given day who are permanently homeless. We have been trying intensely in recent years to bring them in. And in this crisis, again, new ideas are coming to the fore that are actually allowing us to reach people in whole new ways. And I'm going to report something to you that's pretty amazing today. You know, last night was only the second night in which subways were closed down in those very late night hours for cleaning. and therefore all passengers had to leave the subway system. And that meant that our Department of Homeless Services and our outreach workers and specially trained NYPD officers could be there in places where there were a number of homeless folks to help them out and offer them a helping hand and offer them a place to come in and get the support they need. Yesterday we talked about very, very impressive progress that was made just on the first night. But of course the question is, okay, well, what's going to happen the second night, the third night? What does this really tell us? Well, the results on the second night were even better than the first night, which is very encouraging. Last night, our outreach teams engaged 361 homeless New Yorkers coming out of the subways when they shut down. 218 of them, well over half, accepted help. Again, this is the entire core principle of doing this outreach work, to constantly open that door for those who are homeless to realize there's something else that could be done to make their life better. There's a different way they could pursue. 218 out of 361 accepted help. That meant 196 went to a safe haven or a shelter. 22 went to a hospital. Remember, a lot of homeless folks out there need medical care. It's about helping them feel the confidence that they can come in and get help. This is an amazing result. Now, we got a long road ahead, but this is an amazing result. Again, permanently street homeless in New York City, federal studies show year after year in recent years, somewhere between about 3,500, 4,000 people. When 218 come in one night, and then we hope and we pray that with a lot of good work, the vast majority of them will stay in, accept long-term shelter and then affordable housing and all the support they need to deal with whatever challenge they have, whether it's a mental health challenge, a substance abuse challenge, whatever it is. When these kinds of numbers mean that that many human beings who had lost their way now get a chance to live a better life, that's an extraordinary story. So again, thank you to all those extraordinary outreach workers out there night after night, no matter what's going on, they're there. The NYPD officers who got trained to do this work, who are devoted to this work, thank you. Thank you to the MTA, great partnership going now. I think this also is something that could lead to a whole different approach in the future that'll make life in the city better for everyone, particularly homeless New Yorkers. Now, in this crisis, there are some other people who have been really vulnerable. And this is a sad additional story within the story, and it's not something we can ever turn away from. To save people from the disease, to knock this disease back, to save lives, we have obviously had a policy of shelter in place, stay at home, and it's obviously working. For the vast majority of people, it's about keeping them safe and keeping all of us safe. But there are some people who deal with a very different reality at home, where home is not a safe place. And it is a painful reality, and it has been before. In this crisis, we've seen some troubling trends that we must address aggressively. We've seen too much domestic violence, too much gender-based violence. Some people, some observers have said, well, if everyone has to stay home, it's quote-unquote inevitable that would happen. I don't accept that. We can't accept that. We need people to stay home for everyone's safety, but we also have to find a way to disrupt this problem because it's unacceptable. It's unacceptable that anyone would be in danger in their own home. We do not allow that in New York City. So, there's always help available, literally on a moment's notice. If anyone's in danger, not only will the NYPD come to help, and they've put immense resources into fighting domestic violence, but anyone who needs shelter will get it instantly, no questions asked. 24/7, anyone who's endangered, we will help immediately get a roof over their heads and be protected. Anyone who feels endangered, there's a particular hotline for people who are facing this threat. It's 800-621-4673. 800-621-4673. You know the person on the other end of the line will understand your circumstance and will act immediately to get you help. But responding to the crisis is not enough. We have to prevent domestic violence from happening to begin with. The NYPD and so many community organizations, so many providers, advocates have done extraordinary work finding new ways to fight back against domestic violence and gender-based violence. We need to find even more preventative strategies in this crisis and even more ways to protect those in danger. I'm announcing a COVID-19 response task force on domestic and gender-based violence, taking some of the leading minds and some of the people who do the most important work in this city to fight this scourge, bringing them together, working with our mayor's office to end domestic and gender-based violence. We'll bring together about 20 of the leaders in this field, convening them right away to figure out what else we can do and what's working anyplace else in the country or the world that we can bring here. But the bottom line is we're just not going to allow this to happen. No one should be suffering because they're at home. No one should suffer in silence. No one should be afraid that the place that's supposed to be their safe harbor is actually a place where they're endangered. We cannot have that in New York City. This task force is going to help us to come up with new solutions. So, a couple more things, and when we talk about new solutions, I want to talk about the challenge that this city faces. In fact, cities all over the country, all over the world are facing as we fight back this disease, as we restart and recover, and then work together to find a better path for the future. So many cities have in common a lot of realities, and we are increasingly working together to solve problems, to figure out what works one place that might work another place, to share ideas and approaches all as one because we face the same exact challenges. There's not a real sense of difference when you're talking city to city. I can tell you, talking to mayors around the world, everyone has a common language in effect because we deal with the same issues and needs of our people. And we all know that as we come back, as we recover, we're going to be facing some huge challenges ahead, not just from this disease, but from what's happening all around us in this world. This disease has pointed out disparities and has also pointed out the danger of not being prepared for the bigger challenges ahead. So we have to figure out, all of us, all the cities of the world have to work together, particularly to address profound dangers to health and safety when it comes to our climate. We've got to reduce pollution. We've got to reduce emissions. We know if we don't band together, global warming will overtake us. And global warming is the kind of threat that literally everyone shares. It's a horrible danger, but let us pray it is a unifier. And maybe in this moment, as the world has fought this virus together, there's been some signs that the nations of the world might come together in common cause. Well, the cities of the world are doing that already. So we, New York City, have been part of an organization called C40. It's a group of cities around the world that are committed to ambitious action to fight global warming. And now C40 has laid out a set of resiliency principles for the cities of the world to follow in terms of coming back and coming back better. We've signed on to these principles because they give a good, very basic roadmap of the things we all need to do together and the things we're going to help each other do. And that means a focus on not just bringing back the employment we had before, but creating new green jobs. It means investing more in our people, in the health and safety of our people, including in communities that never got their fair share. It means reducing pollution, reducing emissions everywhere. Obviously focusing on communities that have borne the brunt of pollution and the healthcare impacts of pollution. These principles are really helpful in guiding our work. They're going to be the kinds of ideas that our Fair Recovery Task Force works with to broaden them into more and more specific game plan over time. But what's actually inspiring in this moment is I've said to you as New Yorkers, as individuals, you should never feel alone. Your city is here for you. We also should not feel alone because all the cities of the world are banding together to fight these problems and to find solutions together. And that gives me a real sense of hope. As we wind this down, I want to take an opportunity to offer some thanks. And it's amazing, as you've heard this week, there are many days and weeks designated to thank the people who serve us and are there for us, but those days and weeks don't always get all the attention they deserve. In this pandemic, there's a real spotlight on the people who are our heroes, the first responders, the healthcare heroes, the essential workers. So you probably didn't know this before, but you should. It's National Correction Officers Week. And these are heroes who don't get their due. It's a tough, tough job. I've spent time in our correction facilities talking to our officers. They have a very tough job. It's thankless, it doesn't get the acclaim, but it's another crucial part of how we make this city work and how we protect people. Our correction officers have to show a lot of agility, a lot of creativity in doing the work they do, because remember, it's not just the work of public safety, it is the work of redemption. The entire concept, that's why we call it Department of Correction, is to help people come back from their mistakes, never see the inside of a jail cell again. And our correction officers do amazing work to achieve that kind of goal every single day. So to everyone at the Department of Corrections, our correction officers, all the employees of the Department of Corrections, appreciate what you do. It is not easy in normal times. It's been a lot harder during this pandemic. It's been a tough, tough time for all of you, I know. But you keep showing up and you keep making sure everyone is safe, and you keep doing that work of redemption. And I want to thank you, and I ask all New Yorkers, if you know anyone in your life who works for the Department of Correction, please give them a special thank you this week, because they do so much for all of us. We don't get to see it that often, but it's something we depend on a lot. Please give them a real heartfelt thanks. Okay. Now, time for the daily indicators. And again, I'm looking forward to us working together, continuing that strong discipline approach you've all engaged in to get these numbers to go down together steadily. Today, we have progress. It's not perfect progress, but it's damn close. So this is a good day. I want to see even better days, and then I want us to string them together, because that's our pathway to opening up, reducing restrictions, and taking the steps towards the restart. So let's go over the indicators. Number one, daily number of people admitted to hospitals for suspected COVID-19. That is down from 109 to 79. Isn't that good to hear? Only 79 people. Now, for those 79 people, they are dealing with real challenges. So I never want to belittle even if a single person has to go into the hospital for COVID-19. But thank God, compared to where we were, only 79 people as of the latest measure. The daily number of people in ICUs across our public hospital system for suspected COVID-19, that has gone down as well from 599 to 567. Again, still 567, that's a lot of people. But it has gone down noticeably, and that's great. Now, one thing went in the wrong direction, but I will say, thankfully, only by 1%. So, you know, it's still a good day. Percentage of people tested positive for COVID-19 citywide, up 15% to 16%. Overall, right direction. Let's dig in and go farther. Let me offer a few words in Spanish. Este virus nos hace vivir.
You've been listening to Mayor de Blasio give an update on the coronavirus outbreak here in the city. We're now going to return to regular programming here on CBS 2. For extended local coverage, stick with our streaming service, CBSN New York. I'm Chris Raggi.
This has been a special report from CBS 2 News.